Welcome to my blog Sumud. This week I'm discussing mental health of health workers in Syria, a critical yet forgotten issue. Armed conflict is a global health threat and has severe consequences on the health of affected populations. Health workers are key to an effective public health response, and their role becomes more critical in conflict settings. Despite this heroic work, their mental health and well-being is often overlooked. This blog post is based on a conversation with Diana Reyes, an international health PhD student at the Johns Hopkins Bloomberg School of Public Health. Current situation in Syria. The political situation in Syria continues to be extremely dynamic and complex, with a multitude of armed actors on the ground and shifting geographies. The conflict in Syria, which began after the Syrian government cracked down on popular uprising in 2011, has resulted thus far in reported estimates of over 600,000 people dead or missing, and 6.6 million Syrian refugees worldwide, in addition to 6.7 million internally displaced Syrians. The healthcare system in Syria is fragmented, with roughly 3 separate systems operating today, one system in the northwest, one in the northeast, and a third in the rest of Syria, controlled by the Syrian regime. Coordination between these 3 systems is limited, and they rely almost entirely on humanitarian aid for their operations. Mental health situation in Syria. The mental health situation in Syria has always been challenging, even before the onset of the war. There are very few psychiatrists in the country, and mental health policy is practically non-existent. Due to a lack of population-level data, it is difficult to identify the most common mental health conditions. However, symptoms of depression, anxiety, and post-traumatic stress disorder have been reported among Syrians, both inside the country and among those who are displaced. Part of the work that Diana does is to explore other culturally specific mental health conditions that are not based on these Western criteria. These include severe trauma and unexplainable forms of grief that are difficult to cope with. Examples include active and recurring trauma and feelings of hopelessness among people who have lost their entire families and homes. The regular and severe attacks on healthcare facilities in Syria cause health workers to live in constant stress, trauma, fear, and grief when losing colleagues or loved ones. The fleeing of thousands of health workers out of Syria has created an extra burden on the remaining health workers in the country. They often feel helpless and underqualified, and some work up to 80 hours per week. One doctor says during a WHO survey, "Many days we can't speak to our families when we get home because of what we see. We can't look at our children. We think, what if this happens to them? We're doctors, but we're also human." As part of a study that Diana did with colleagues, they asked doctors if they are accessing mental health or psychosocial support through their respective organizations. They found out there is limited specialized support being provided to doctors. This is mainly due to the lack of available specialists and lack of understanding of how these health workers can be supported. Examples of coping mechanisms used by health workers include feeling grateful that they have families to spend time with after long and stressful days. Their spiritual beliefs also help them to keep going, whereby they rely on beliefs around faith and feelings of fulfillment that they are risking their lives to help others. Nonetheless, these are not long-term solutions, and health workers require specialized mental health care. Recommendations. Diana recommends research priorities that would include large-scale quantitative surveys to assess the mental health needs of health workers in Syria. There is also a critical gap and a need to increase specialized mental health and psychiatry trainings in Syria. Interventions such as trainings on self-help and peer support among health workers can be piloted in Syria. Such interventions must be needs-based and should involve health workers in the design and implementation processes. On a policy level, strengthened coordination between the different healthcare systems is required. This includes increasing efforts through humanitarian policy and the critical role of NGOs and UN agencies in addressing mental health issues. It is also essential to address the underlying political determinants of mental health issues. Mental health of Syrians, including that of health workers, will continue to deteriorate if the war persists.